Hello and welcome everyone. Today we are discussing about glucose tolerance test. In this video we are going to discuss about introduction, tests, sample, procedure, methods and interpretation of glucose tolerance test. A glucose tolerance test is a procedure that determines whether a patient can use and store glucose normally. The test is usually used to test for diabetes mellitus, gestational diabetes, insulin resistance, impaired pancreatic beta cell function, and sometimes reactive hypoglycemia or acromegaly, or rarer disorders of carbohydrate metabolism. There are two types of tests. One test is routine test, that is for non-pregnant patients. This test includes testing for fasting glucose and the glucose level after 2 hours of ingestion of 75 gram glucose. And for gestational diabetes mellitus, there are two types of tests. One test is one-step test and the second test is two-step test. In the one-step test, the fasting sample is collected and patient is advised to take 75 gram glucose, and after 1 hour and 2 hour glucose samples are collected. In the two-step test, the first step include testing under the non-fasting condition and the second step include samples taken during fasting condition and after ingestion of 100 gram of glucose. The samples collected are fasting 1 hour, 2 hour and 3 hour. Specimen. Sample to be collected are either serum or plasma and it should be free of hemolysis or lipemia. The plasma sample should be separated from cells within 60 minutes of collection unless the tube contains glycolysis inhibitor. Serum samples are appropriate for glucose analysis provided the serum is not in contact with cells for longer than 90 minutes. Sample should contain a glycolysis inhibitor, which is sodium fluoride, which inhibits enolase enzyme. The concentration of fluoride will be 2.5 mg of fluoride per ml of blood. Glucose concentration are stable for 72 hours at room temperature with fluoride. The glucose concentration does not change in serum or plasma samples collected in tubes that contain a gel separator. The glucose in these tubes is stable for at least 1 week when stored at 4 degrees centigrade. Now let's discuss about the conditions in which the sample to be collected. Discontinue when possible medications such as corticosteroids and diuretics which are known to affect glucose tolerance. Perform the test in the morning after 3 days of unrestricted diet containing at least 150 gram of carbohydrate per day and activity. And perform the test after 10 to 16 hour fast only in ambulatory outpatients who should remain seated during the test and they should not smoke cigarettes. Glucose tolerance testing should not be performed on hospitalized, acutely ill or inactive patients. The test should begin between 7 am and 9 am. Venous plasma glucose should be measured fasting and 2 hours after an oral glucose load. For non-pregnant adults, the recommended load is 75 gram. For children, it is 1.75 gram per kg up to maximum of 75 gram is given. The glucose should be dissolved in 250 to 300 ml of water and ingested over 5 minutes. Now let's discuss about the methods. There are two methods which are popular for glucose estimation in laboratory, and they are glucose oxidase peroxidase method and hexokinase method. The principle of GOD-POD reaction is as follows. The glucose is oxidized to gluconic acid while oxygen is simultaneously reduced to hydrogen peroxide by enzyme glucose oxidase. Hydrogen peroxide is then split to form water and nascent oxygen by enzyme peroxidate. The nascent oxygen reacts with 4-amino antipyrine and in presence of phenol, this reaction produces quinonamine which is colored compound that can be analyzed using colorimetric analysis. The intensity of color produced correlates directly to the concentration of glucose in the sample. The colorimetric analysis is performed at 505 nanometer. The hexokinase method is considered the fastest and most accurate and is commonly used on automated systems. Serum or plasma is first deproteinized by barium hydroxide and zinc sulfate and clear supernatant are used for the reaction. Glucose in the sample first reacts with ATP with the help of hexokinase enzyme to form glucose 6-phosphate. Glucose 6-phosphate is then acted upon by glucose 6-phosphate dehydrogenase in the presence of NADP+ to form NADPH and 6-phosphogluconate. The amount of NADPH generated is measured by recording absorbance at 340 nanometer, which is proportional to the glucose concentration in the sample. This table shows various reference ranges of fasting blood glucose and glucose tolerance test. If glucose level is between 70 to 100 mg per dl, then it is normal in fasting condition. If the fasting blood glucose level is 100 to 125, then we can say the patient has pre-diabetes, and if the fasting blood glucose level is more than 126 mg per dl, then patient can be suffering from diabetes. For the oral glucose tolerance test, if glucose level after 2 hours of 75 gram glucose ingestion, if it is less than 140 mg per dl, then it is normal. If it is between 140 to 199 mg per dl, then it can be pre-diabetes, and if it is more than 200 or equal to 200 mg per dl, then we can say the patient can be suffering from diabetes. This table shows various limits of oral glucose tolerance test in gestational diabetes mellitus. In the one-step test, if FBS is less than 92 mg per dl, then it is normal. After 1 hour, it should be less than 180 mg per dl, and after 2 hours, it should be 153 mg per dl. If any one of the limits are higher than the recommended values, then we can say the patient is suffering from gestational diabetes mellitus. Another test is two-step test. In the first step, the glucose is measured during the non-fasting condition, and after giving a 50 gram of glucose, 1 hour blood glucose level is checked. If it is more than 140 mg per dl, then the first step is positive and the second step is recommended. In the second step test, the fasting blood glucose level is measured, and if it is less than 95 mg per dl, then it is considered to be normal. In the first hour, it should be less than 180 mg per dl. In the second hour, it should be less than 155 mg per dl. In third hour, it should be less than 140 mg per dl. If among these any of the two levels are elevated, then we can consider that the patient is suffering from gestational diabetes mellitus. These are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.